And a Fox Carolina safety alert, moving your body and staying active are important for so many reasons. One of them is to prevent disease like cancer. And there is new groundbreaking research that finds exercise is better than drugs to stop cancer from returning after undergoing treatment. Secours St. Francis oncologist Dr. Koehler breaks it down.
The exercise was huge. It definitely proved that more people were in remission, but it's not a replacement for the chemotherapy.
Dr. Koehler says think of exercise as a supplement on top of your chemo treatment. The first of its kind trial involved nearly 900 colon cancer patients from all across the U.S. and across the globe over 15 years. Most had stage 2 or 3 disease and underwent surgery or chemotherapy. Patients were randomly assigned a structured exercise program or received a healthy lifestyle book, basically education material on working out. Well, after 5 years, patients in the exercise group had a 28% lower risk of that cancer coming back or new cancer cells than those in the education group. And after 8 years, it grew to 37%.
With the same evidence we expect for the medications, the drugs we recommend, that same type of evidence shows that exercise had a huge benefit. Trying to build it into your routine, even if it's a walk at lunchtime or playing basketball with friends, right? We don't all have to go to the gym and be like super fit, but having some amount of physical activity would be huge.
The results were transformative, showing exercise reduces the risk of recurrent or new cancer and helps you feel better and live longer. Now, the findings of this study will likely change the way doctors talk with patients about exercise routines around the world. Dr. Koehler believes it could lead to changes in insurance coverage, too.
It might actually be an impetus so that insurance companies would have to help cover that cost of those exercise regimens, right? Because just like when we approve a drug, because we say we're curing more people, and insurance companies generally have to cover that medication, now we have this data, level 1 data, that we've never had before for exercise, where we'd actually be able to say, okay, well now we could put you in with this gym, get you a membership, that kind of thing, and have it be maybe even partially or totally covered by insurance.
Dr. Koehler and I also discussed the increasing number of younger people receiving a cancer diagnosis over the last few decades. And he says we don't necessarily know why, but you can see a correlation with diet and a sedentary lifestyle. So some things you can do to stay healthy, as simple as walking and monitoring your diet and eating less processed foods, because those tend to have a lot of added sugars, chemicals, and additional additives. Reporting in the studio for Fox Carolina News, I'm